Are you currently suffering from back pain and confused whether you should exercise or rest it? Hey everyone, this is Dr. Zach Greenwood here, Performance Sport and Spine, and today's video we'll be discussing low back pain, what you need to know, and then all the ways to self-manage it. So for the anatomy, we're talking about the low back or the lumbar spine, which are these 5 bones, the discs and the ligaments, and then the pelvis, as well as the muscles, ligaments, and tendons. Low back pain is the #1 cause of disability worldwide, and it's estimated that 39% of adults will experience back pain in any given year. And back pain is a symptom, not a cause. So there's different reasons your back can hurt, similar to a headache. It could be from a serious pathology such as fractures or infections. The nerve root could be compromised and you could have sciatica-like symptoms, which has leg pain and back pain. Or most people just have mechanical back pain, or called non-specific back pain. We'll dive into these 3 different subgroups in more detail later in the video. What does this condition feel like? Well, it presents as pain, stiffness, or tightness, anywhere from the inferior margins of the ribs to the gluteal folds. And the symptoms can present on a continuum anywhere from mild to debilitating, and the quality can be anywhere from dull to stabby. With mechanical low back pain, it can be incredibly painful, but it's not medically serious in the sense that the pain is coming from irritated or sensitized tissues, not damage. But you should always seek out the care of a trained healthcare provider to figure out which group you fall in. Contrary to popular belief, back pain doesn't get worse with age. As you can see from this chart, back pain is more prevalent in adults than the elderly. What is causing your back pain to happen? There's a good chance you've been told it's due to your core is too weak, one leg is shorter than the other, your spine or your pelvis is twisted, but it turns out there's really not any evidence to support this. And again, this is about irritation, not some damage or asymmetry. If you please like our video, subscribe to our channel, and don't forget to turn on notifications. So here's 5 more evidence-based reasons. So think about in the past few days or weeks, have any of these things happened prior to the onset of your back pain? Number 1, have you lifted something heavy or awkward? Number 2, have you had a prolonged awkward position or posture? Number 3, have you had a large increase or decrease in your physical activity level, approximately 30%? Number 4, have you been sleeping significantly less or the quality of sleep is worse? And then number 5, have you had a large personal or professional stress in the last few weeks or days? These last 2 are more likely to re-irritate a prior episode than cause an initial onset. Again, pain is very complex, and why you're experiencing it can happen for a multitude of reasons, and it's individual to the human experiencing it. It can have biological, lifestyle, psychological, and social factors. Here are some risk factors for having low back pain: obesity, smoking, a heavily physical demanding job, and then physical or social comorbidities. There is good news, however, and most people have a favorable prognosis and get better relatively quickly. This great paper looked at how fast people recover from back pain, and they found the median episode for back pain was 5 days, and that 70% of people felt better in 1 week, and 91% felt better before 6 weeks. And since there's different factors, this is why your back pain feels better on vacation than when you're busy at work and life. And if this is really acute, often it's hard to get on the floor, so here's a couple options that you can do in a standing or seated position. The standing march. So placing your hand against a wall or a pole, we're going to pull one leg up and then the other. Now again, if you only can get to 45 degrees and the pain gets too much, don't try to push past that, but just again start and then try to increase the range of motion over time and make sure the pain is not increasing with each rep. Standing extension. So placing our thumbs on the top of our hip bones, we're going to press our hips forward and then lean backwards or arch backwards. Again, you can feel some mild discomfort during, but it should not increase over time. And we're not trying to crank on it. We're just trying to add some gentle movement to help work on decreasing that pain and add motion to the spine. And then a seated position with your knees bent, we can gently kind of reach down towards the floor. And again, don't hold your breath or guard. And again, don't go all the way at first. But try to increase your reps over time. And again, the pain should not increase with each rep. We're going to go over some gentle stretches and movements. We highly recommend that you try them all and then focus on the ones that are most helpful. So the first one is the quadruped tilt. So on your hands and knees, we're going to take our pelvis or our bull and then squeezing our glutes, we're just going to try to roll it backwards and forwards. Now again, go gentle, but the goal is not to make it high intensity. And then each rep, you're trying to go a little bit farther. And the pain may increase during, but it should not be any worse after you're done. And the pain should not get worse with each rep. So the quadruped rock back. Again, on our hands and knees, we're going to gently roll back onto our heels and then come forward. Again, we're trying to build confidence and not be stiff. So try to work into it, but don't crank into it. This is low load, and the pain should not increase with each rep. And the goal is over time to increase the range of motion. The tail wag. So on your hands and knees, we're going to wag our hips to one side and then the other, similar to a dog waggling its tail. And you want to focus on your low back. And again, try to increase the range of motion with each rep, but it's low load. We're not trying to force or crank anything here. Supine rotation. So on your back with your knees bent, we're going to gently let our leg weight kind of rotate our back side to side. Again, we're going to start slow and initially increase the range of motion and then the speed. Some people may feel comfortable put their hand there as kind of a guideline to know how far to go. But again, the pain should not increase with each rep, and work on increasing the range of motion over time. So the hip hike. So laying on your back with your feet straight, put your hands on your pelvis. We're going to hike our hip up towards our shoulder and then repeat on the opposite side. Again, there's not a lot of movement, and you want to start slow initially and then increase the range of motion and speed over time. And really think about drawing that hip up to your shoulder and then the opposite side relax. You can also do this in a standing version. So with the back against the wall, hike one hip up and then the other. Again, try to move just your hip and not tilt your shoulders side to side. We're now going to go over the exercise and rehabilitation portion of this video. Isometrics seem to be a good starting place for a lot of people. But again, there is no best exercise for back pain. So if you find something else that works better, that's great. Again, just find the right entry point and then progress as your symptoms allow. Hip adduction. On your back with your legs bent, place a small ball or cushion between your knees and then squeezing your knees in, press and hold. Work up to 20 to 30 seconds and increase the intensity over time. The hip abduction isometric. So laying on your back with your knees bent, place a stiff band around your legs just above the knee. And then pressing outwards with your knees into the band, hold. Work up to holding to 30 seconds. The glute bridge isometric. So laying on your back with your knees bent and your palms flat on the floor. We're going to lift up with our hips towards the ceiling and hold. Work up to 30 seconds. Laying on your back, bring one hip up to 90-90 and place both hands against your knee. You're going to press up into your knee with your leg and hold up to 10 seconds. Increase intensity over time. And then repeat on the opposite leg. And then the standing rotation isometric. So placing both hands against the wall with your feet spread, we're going to press our hands into the wall and work up to holding to 20 seconds. Then repeat on the opposite side with the same dosage. And then lastly is the squat or the box squat. And this is really important because this is a very functional movement. Everyone stands and sits every day, all the time. So building confidence in that motion is important. So for the squat, keep your weight over your midfoot and trust your hips. So our knees should be relaxed. We should squat down, loading our legs, and then stand up. And again, this is low load. We should not be bracing. This only takes about 2.5% of your core. So again, it's building confidence in the movement without guarding. If you find that your back is starting to arch or extend beforehand, we want to break the habit. So it should look like this. And then here's 3 important factors to think about. People with back pain versus without back pain. So number 1, people with back pain are going to move slower and stiffer compared to people without back pain. Number 2, people with back pain move more robotic or in one direction, where people without pain move in variation. And then lastly, if you have back pain, you're going to move more guarded and you'll be more fearful of certain movements, where people without back pain don't have that worry. Therefore, it's incredibly important that if you follow some social media guru or some physical therapist or chiropractor, if they're telling you to move slower, to be more stiff, that there's only one right way to do stuff and that there's a way that's going to damage your back, this is not going to be helpful. On the contrary, if they're trying to give you ways to promote different kinds of movements, decrease the stress, and build confidence in whatever task or goal you have, this will be helpful. But again, our beliefs about pain greatly influence our experience of pain, and so we need to build resilience and robustness, not a fragile system. A really helpful analogy is a mild ankle sprain. So anyone that's ever experienced it, they can be incredibly painful for a few days or weeks. And again, you're going to do less, but you probably just don't lay in bed. You may walk to the kitchen and then back. The same thing applied to your back. Again, you can do some stuff and it's going to be really painful, but you're not going to cause more damage. You want to find the most that you can do without aggravating your symptoms. But again, this is about irritation, not damage. Now we're going to go over in more detail the different subgroups of back pain. So the first is any specific spinal pathology, and this approximately makes up about 1% of all cases. And this could be included, but not limited to, fractures, malignancy, infections, or axial spondyloarthropathies, and often these are medical emergencies. The second subgroup is radicular symptoms, and this approximately makes up 5 to 10%, and this is where there's nerve root irritation or compression. But again, for this subgroup, you must have leg symptoms. And then the last subgroup is the non-specific or mechanical back pain, and this approximately makes up about 90% of all symptoms. And again, a tissue is irritated, but we don't have any valid or reliable tests to identify which tissue it is. Engaging in meaningful activities and exercises is very important. Again, we need to do things that we like and that keep us healthy and strong. Let me give you an example. I recently had a patient that loved playing tennis and was a Division I player in college that could play an hour and a half no problem. Well, now he's in his 40s and has a job and kids. And the weekend before, he had played with a buddy for an hour and a half and his back flared up and he's very frustrated. Well, I talked to him about this is not a fitness perspective, it's a pain perspective. And he just doesn't play tennis that much, so his body wasn't currently able to handle that. So what we decided to do is play tennis for half an hour for 2 weeks and then reevaluate. And it went a lot better. He was a little sore, but it managed after 1 day. And then we gradually progressed this. And over the course of 1 month, he was able to play for an hour and a half without a problem. Here are some factors to be aware of that will decrease your prognosis or increase the chance that you get persistent pain. Number 1, is it a high level of pain initially? Number 2 is psychological distress. And then number 3 are multiple sites of pain besides the low back. And then dealing with back pain, the more healthy you are, the less likely you're going to have it or the faster you're going to recover from it. And exercise and movement is a big part of that, but there's some other factors that we want to consider too. So good sleep is highly protective. So if you're not sleeping very well or your quality is poor, increasing that is going to help. If there's excessive drinking or smoking, decreasing that will definitely help. You also want to eat an anti-inflammatory diet and be nutritious as possible. Thank you for watching our video on low back pain. We hope you found it educational and helpful. If you did, please like our video and subscribe to our channel, and don't forget to turn on notifications.